Hello, my name is Dr. James Genuario from the Steadman Hawkins Clinic, Denver. On this video, I'd like to share my techniques and pearls for performing various procedures in hip arthroscopy. At this point, I'm going to demonstrate capsular closure. Complete capsular closure is important both to limit hip microinstability or frank hip dislocations. A recent multi-center study demonstrated improved clinical outcomes with capsular closure versus partial or incomplete repair of the capsule. First, I'll use the injector to close the capsule. The injector provides a rapid and efficient way to pass suture through the capsule without the need for suture shuttling. I'll hold the hip in 30 degrees of flexion to relax the capsule. I'll then pass a suture through the distal limb, followed by a suture through the proximal limb. These can either be tied in sequence or can be tied after all sutures have passed. I'll demonstrate tying them in sequence at this point to minimize suture management. Traditionally, in a T capsulotomy, I'll pass 2 sutures in the vertical limb and 2 sutures in each of the medial and lateral leaflets. They'll then be arthroscopically tied in progression. While using the injector, it's important to notice if there are any tangles as the suture is passed. At this point, I'm demonstrating a figure 8 technique where I've passed sutures in the distal, then proximal, then distal, then proximal limbs, and then arthroscopically tied the suture. This is a robust suture configuration. I'm now arthroscopically tying and closing the medial aspect of the capsule as viewed from the anterolateral portal, and closed and arthroscopically tied from the mid-anterolateral portal. The slingshot is another option for closing the capsule. The slingshot provides a rapid and efficient way to close the capsule. You can also use a slingshot to plicate the capsule. The slingshot will place a long length of suture through the capsule that'll be easy for retrieval. I've passed the slingshot first through the proximal limb of the capsule and now retrieving the slingshot suture through the distal limb of the capsule. As discussed with the injector, this can either be tied in sequence or can be tied at the end after passing all suture limbs. You can now see the entire capsule has been closed.